Hello and welcome. Today I'll be continuing on the series Misconceptions about Arthritis. Now, in previous videos, I've actually done some, and I encourage you to click the links below and watch them, and hopefully you'll be able to gain some insights. Now, today I'll be discussing two more misconceptions about arthritis. Number one, that arthritis is just arthritis, and so people tend to underrate it. Now, sometimes you've heard people talk about arthritis being simply arthritis. After all, it's just a joint problem. Now, the problem with that assumption is the thinking that because it is arthritis, it's simply a joint problem. However, what people may not realize is that some types of arthritis tend to have systemic manifestations. Now, when people make that statement, they are trying to ask the sufferers not to make too much of a big deal about it. After all, it's simply just a joint problem. Now, the systemic manifestations of arthritis could involve the lungs, the liver, and even sometimes the kidneys and the brain. Therefore, arthritis is not a condition to be misjudged or underrated. Some types of arthritis can actually be so debilitating as to cause patients to become wheelchair bound or even make them lose their jobs because of the impact of the disease on their joints, and worse still, can actually shorten lifespan if not properly managed. Now, it's important for us to realize that the fact that the initial presentation is the pain and swelling in the joint doesn't mean that systemic or organ involvement may not be there. And so it's important that we do not underrate or misjudge people that have arthritic problems. Another misconception is that the orthopedic surgeons are primarily responsible for the management of arthritic problems. Now, this is not exactly correct because the primary doctors that are trained in the medical management of musculoskeletal or rheumatic disorders are rheumatologists. However, in certain places where there may be inadequate numbers of rheumatologists, orthopedic surgeons have been helping to attend to those patients, but that doesn't mean that they are the ones that are primarily trained in the medical management. Now, I'll give you an example for us to appreciate the multidisciplinary approach sometimes when managing patients that have arthritic problems. Now, if you have a patient that has, say, rheumatoid arthritis, the rheumatologist carries out medical management of rheumatoid arthritis. However, if that same patient now develops a damaged joint that is not responding to conservative or medical management, the rheumatologist refers the patient to the orthopedic surgeon who may carry out joint replacement or arthroplasty in that patient. Now, the surgical management is carried out by the orthopedic surgeon, but the medical management continues to be carried out by the rheumatologist. And so that's the collaboration that occurs between a rheumatologist and an orthopedic surgeon. And so an easy way to remember this is that the medical management is carried out by the rheumatologist, whereas the surgical management is carried out primarily by the surgeons. And so, easy way, rheumatologists do not do surgeries, but orthopedic surgeons do surgeries. I hope that clarifies the point. Thanks.